July is going to mark 1 year since the launch of the 988 Suicide and Crisis Lifeline.
The goal is to make 988 as well known for mental health needs as 911 is, but a new survey suggests we have a long way to go to do that. Dr. Frank McGeorge is here with a closer look at where things stand right now, Doc.
Well, Kim and Devin, right now, a nationwide survey actually asked about 5,000 adults about their awareness of the 988 Suicide and Crisis Lifeline. Well, it found only 13% of American adults knew about 988 and understood the purpose. However, 7 in 10 actually said they might use it once they were told about it. Now, in spite of the need to increase awareness, the hotline actually answered 160,000 more calls, chats, and texts last month than a year ago. So it is definitely helping more people, and it's helping them more quickly.
Yeah, imagine if more people were aware of it, though. So what's being done to increase the awareness?
Well, you know, there's definitely still some gaps out there, and the survey found twice as many white people were aware of the 988 line compared to black people, and those with college degrees were more aware than those without. Obviously, those are things that the awareness campaigns need to address. And to be clear, you also do not have to be suicidal to call or text 988. It's actually to help people with a mental health crisis or any other kind of emotional distress or substance abuse crisis. They have trained counselors ready to deal with any or all of those situations.
I'm not sure substance abuse was considered by a lot of people to be a part of that as well when we had the original rollout.
Right. Well, and it's so important now that we have the substance abuse awareness that people have.
So right. All right, Doc.